Tell me about yourself and why you feel you are qualified for this management position.
Hey, my name is Nikki Page. I am an energetic and self-motivated registered nurse with a background in emergency medicine, general medicine, and procedural medicine. I also have a background in business office administration within the healthcare field, as well as clerical work before I actually went into the healthcare field. I have been actually in the healthcare field for probably about 6 years now. In various different positions. I started out as a CNA, went up to the business office administration assistant, became a registered nurse, and started doing emergency medicine, then the general medicine and the procedural medicine. I'm accustomed to working very effectively and diligently in stressful situations. I've dealt with a number of different critical patients, and I'm very graceful under pressure. My natural leadership and communication skills definitely qualify me for the management position that you are currently offering at your hospital. My sharp organizational skills will provide me with the expertise needed to establish objectives as well as plan, budget, delegate, educate, and motivate my staff.
What is your style of leadership? What style do you prefer your supervisors to display and why?
So my style of leadership is definitely a democratic style type of leadership. I believe it's super important to include my employees in on any decision that goes on within my unit. To me, the democratic style of leadership is the fairest way to treat my employees. A democratic style of leadership makes all parties feel that their voice is being heard and that they are able to include their input on the decision-making process within the unit. This creates a positive work environment. This creates a voice for your employees, and just overall is, in my opinion, the best way to operate things.
Describe the core values that are most important to you and why.
So the core values that are most important to me in regards to work culture are integrity and teamwork. In order to display integrity, one must be honest and fair. This is extremely important, especially in the healthcare field. You have to be honest when you're dealing with medication administration. You also have to be fair when you're dealing with the assignments that you're creating on a daily basis for your nurses. If one nurse had a horrible day yesterday, you definitely don't want to give her that same assignment the next day. That just wouldn't be fair for her. And in order to display teamwork, one must be positive, hardworking, and you must look out for your other teammates. That's extremely important also in the healthcare field. You know, one nurse in particular might be having a really bad day, whereas another nurse is having a good day. You need to be able to read each other and say, hey, Mallory over there is having a really bad day. I need to go help her. I'm not busy right now. The best thing for me to do would be to go help her, because if you were in that situation, you would only want someone else to do that for you as well.
Give an example of a model of care that you believe is effective in delivering high quality, physically responsible care.
So the model of care that I believe is effective in delivering high quality, physically responsible care is the model in which the patient is at the center of everything that we do, and then the hospital resources revolve around the patient. As a member of the healthcare field, we cannot sacrifice the safety of our patients in order to save a dollar. That's just, there's no tolerance for that. It's extremely important to ensure that our patients are receiving the highest quality of care that we can provide to them, and that also that we're using safe products and supplies on our patients. So you should never sacrifice a dollar, never sacrifice patient safety in order to save a dollar. But with that being said, there's always room for improvement in the budget and spending on any medical unit. So you would just have to diligently look at your budget on a monthly basis and see where you can actually cut back at. Whether it's by decreasing our turnover rate on nurses, by improving work culture, which in turn would decrease our need for travel nurses as well as float nurses, which would decrease the unit's cost for for like nurse staffing, or whether it be by researching new products to use on our patients that are similar and safe to the ones we are currently using but cost less. So by incorporating high quality patient care, improved work culture, and responsible usage of supplies and budget, you can definitely be physically responsible. It's also important to just hold your staff members accountable, especially in the healthcare field. I think that's a very effective way of getting to your staff members and letting them know that this is important. Just holding each other accountable of the spendage that your unit is currently doing.
List 3 skills that you feel are most important for your managers to use when leading an interdisciplinary team. To what extent do you possess these skills?
So 3 skills that I feel are most important for any manager to use when leading an interdisciplinary team would be communication, delegation, and planning. I believe that I'm very effective in these 3 skills. I love to lead as well as instruct people in a positive manner. By being a manager, it involves a great deal of communication, not just communication, but effective communication. You must communicate basically every second of the day in order to be effective and efficient at your job. So the same goes for planning and delegating. As a manager, planning and staying organized are extremely important. With budgeting, with patient assignments, a great deal of management is planning and organizing. So without all of those 3 skills, you would definitely be lacking, and that wouldn't be good. But I believe that I do possess these skills on a daily basis.
What management skills are you lacking? What is your plan for developing these skills?
So by no means am I perfect. I am a human being just like everybody else. Where I do believe that my management skills are lacking would probably be my fluency of management. I've been a clinical nurse for a couple of years, but I've never actually had the title of management. I've led my team members, but like I said, never held that title. So the way in which I feel like I would develop these skills would be to continue taking professional management nursing classes, as well as just practice makes perfect. Just fine-tuning my management skills at work on a daily basis. And just, jotting down what I feel like could improve with my flow of management, and just each day going through that list and seeing what I have improved on throughout the day at work.
In what ways are planning and budgeting related? What factors would you consider when planning the budget?
So planning and budgeting definitely go hand in hand. You can't have one without the other. In order to budget, you must precisely plan. It's extremely important. So the factors in which I would consider when planning the budget are overhead cost, turnover rates, travel nurse rates, float nurse rates, supply costs and supply need, revenue, any plans for growth in the business, example, the opening of a new med-surg unit, as well as looking at the statistics of your patient population. If you know that you currently work on a med-surg unit and you guys are about to start taking on more orthopedic surgeries, you know that your revenue is going to increase and that you're probably going to need to get more supplies that are geared towards the orthopedic care of nursing. Same goes for like gynecology. Even if you see like a decrease in the percentage of surgeries that you're doing on, say, like gynecological patients, then you're going to know, hey, I probably don't need to spend a lot of money on these supplies because we're not doing that many surgeries anymore. So you do have to take into consideration any change that may be going on within your business, as well as your patient population, so the needs for that patient. Geriatric and bariatric patients may require totally different supplies and totally different needs than, say, your cardiac patients or your pulmonary patients. Some patients require tube feeds, some patients require TPN, so you have to take in consideration the needs of your patient population. That plays a big factor in the supplies, as well as the cost, as well as the nurse experience that you're going to need on your unit, as well as like some patients require medications that are more expensive in comparison to other specialties. So you do have to take all of that into consideration when planning and budgeting. And like I said before, you can't budget without planning. Planning is number one when you are budgeting.
Let's assume that you are hired into this position and that the budgeting process has already been completed by the previous manager. You notice that the budget does not include enough money to cover staffing expenses for 3 months of the fiscal year. What steps would you take?
So in this situation, you would definitely have to look further into the issue. So you just have to assess the situation. You really don't have enough information at this point to figure out what's going on. Did the previous manager overlook some finances? Was there a typo? You really don't know what's going on. So you would definitely need more facts. Why is this happening? How long has this been happening? Is there like new staff members that have come on board and that's the reason why there's not enough money to cover staffing expenses? Was it not in the budget previously? How much money are we short for those 3 months to cover the expenses of the staffing? Then based on the information that I do receive, you would definitely have to create a plan, and you would have to budget to allow for improved staffing expenses. Hospitals can't function without staff, so there are primary means as well as the patients for revenue. So you would definitely have to look into this situation, get the facts. I would get the facts from, first I would ask, around the unit, what's going on, has anything changed? Talk to my team leaders, see if anything has changed, and then take it to administration and see what's going on and come together collaboratively to develop a plan to improve the expenses for the budget.
How would you describe your level of emotional intelligence? Give 2 examples of how your emotional intelligence has positively impacted a group or team.
So I believe that I am very emotionally intelligent. I always try to acknowledge the feelings of my fellow employees, and I always try to take in consideration their concerns and fears. I'm also very good at reading people. I can tell when someone's sad, stressed out, happy, concerned, or just having a bad day. And I think these are all very good qualities to have because it creates a nurturing and team-building work environment. So without all of that, you could have a hostile work environment. So definitely would say that taking into consideration other people's feelings, as well as reading people. Sometimes people are going to have a bad day and they're not they're not going to come out and say what's going on. So sometimes you do have to be sensitive to your employees and, ask them what's going on. Is there anything I can help you with? And go from there.
Is there anything else you feel would be important for me to know about your qualifications to lead and manage the Med-Surg units?
So, in closing, I would be honored to be able to join your team of excellent nurses. Patient safety is always, the main concern in my book. It always comes first. After that, budgeting, planning, delegating, and communication and honesty come right behind that. But nothing can surpass the patient safety. Patients come first. That's why we're here at our job, to care for our patients. In closing, I will work hard every day to ensure the management roles are taken care of and exceed your expectations. That's it. Thank you for your time.